My name is Jason. I'm the Technical Specialist at M.A.R.S Bio-Med. Today's preventative maintenance course is talking about the SolmeteX Hg5 amalgam separators. What I'm going to do is inform you on the manufacturer's required maintenance. The City of Toronto did a study. They found 70% of amalgam separators are not maintained or installed correctly. And this is mostly because most service companies and dentists aren't educated on the required maintenance of these systems. Once these systems are maintained properly, you'll have a fully functioning office, which could save your suction and keep your office running efficiently and compliant. The first thing I want to suggest is page 5 and 4 of the SolmeteX manual require a weekly maintenance of this system. What I like to do is take my cell phone, and what they suggest is take a flashlight and shine this against the filter. Use multiple sections. As sludge builds up on the side walls, it's hard to determine if it's just buildup on the walls or actual fillage. So what I do is I look in a couple of sections until you see light. Once you see light and you move it around and you see light in a few sections, this will give you an indication of where the sludge level is. While you're down there once a week doing this maintenance, I would also suggest shining in the upper chamber. The SolmeteX inlet is about a 3/4 inch inlet. And if a piece of biofilm sits on top of this, you may have something where your filter looks empty, but your upper chamber is building. Do not fret, there's a way of solving this issue. What I'm going to suggest is the same procedure SolmeteX suggests when removing and filling or changing a SolmeteX filter yourselves. Wear gloves. They also suggest wearing a coat and some protective gear. The most important piece of protective gear that I suggest I have every certified M.A.R.S amalgam separator specialist is taught to do this when changing any amalgam separator, to wear a respirator. This respirator is rated for mercurous gases. When mercury amalgam sits in water, it dissolves into a soluble form because the tin has an ionic charge that releases mercury into a gas. What happens is when you mix biological, blood, saliva, with elemental mercury, you get methyl mercury. And that's what happens in amalgam separators. They create methyl mercury. So I would wear a respirator like this. This is a 3M respirator rated for mercurous gases. Once we have all our safety equipment on, we're going to try to remove the blockage in the upper chamber and bring it down to your empty filter. Leave your suction running. You're going to pull your pins, and the suction will help keep the filter in place, and you're going to tilt the filter slightly. What this is going to do is going to allow air into the inlet, jostle things around that may have been causing the clog, and then you're going to put the filter back, put your pins back in, there we go. This should allow, come back in 24 hours. This should allow anything in the upper chamber to fall into your empty filter. If your filter is full and your upper chamber is full, the next procedure is to determine how full. Now, if you have a couple inches in the bottom, when you change out your filter, keep in mind, you'll probably have about 1/3 of your filter full within a short period, let's say a week, because everything up here is going to fall. Now, if your amalgam separator has been neglected for a while and you have significant buildup in the upper chamber, it is recommended the more economical route is to replace the entire system, even if you're replacing it with another SolmeteX. But if you have sludge up to here, you're looking at about 3 or 4 filters worth of buildup. And you'll be going through 3 or 4 filters within a month's period, roughly, just to clear your upper chamber clog. This could cost a significant amount of money, and to buy a full unit would be the least expensive and more economical route. The next bit of information about this amalgam separator is how often the filter needs to be changed. Many service companies don't have the appropriate training on amalgam separators in general and don't understand how often these filters needs to be changed. Please go onto the M.A.R.S Bio-Med website and talk to one of our certified amalgam separator specialists. We offer certain service companies training on amalgam separators, the same training we offer to water treatment plants. Filter-based amalgam separators, such as the SolmeteX, require their filters to be changed once a year or 12 months, or when it's full, whichever comes first. It's not one or the other. If you have a half-filled filter after 12 months, the system needs to be changed to become compliant. I hope you found this information very helpful. If you have any questions, please do not hesitate to call M.A.R.S Bio-Med at 1-866-594-3648, or please visit our distributor page and talk to our certified amalgam separator specialists. You could also call SolmeteX for any further questions about the maintenance of these systems. Thank you for watching our preventative maintenance video on the SolmeteX Hg5.